The final piece that we're going to go over when it comes to protecting your financial plan is your health insurance. The purpose of health insurance is to protect you from an unexpected medical event. And this could be something as simple as having strep or the flu to an emergency or being diagnosed with cancer or having a heart attack. From the very simple to the very extreme, your healthcare insurance is meant to help you pay for those healthcare costs. Thanks to the Obama administration and the Affordable Care Act, all insurance companies have to cover preventative care. So, annual checkups, prostate exams, mammograms, all of those services are now covered by health insurance policies, and you should take advantage of these. The changes that were made by the Affordable Care Act are going to help people potentially live longer. When it comes to health insurance, there are terms that you should be aware of. The first one is the premium, and that's the monthly amount that you pay towards your health insurance. And if you get your health insurance through your employer, then most likely your premium is deducted from your check. And this is a pre tax benefit. So before federal and state income taxes apply, you get to reduce your income by that premium amount. Next is the deductible. The deductible is what you are willing to pay for your healthcare cost. The less that you're willing to pay, the higher your premium is going to be. The more that you're willing to pay for your healthcare costs, the less your premium is going to be. Once you achieve your deductible, you're going to pay a certain percentage of your healthcare needs up to your out of pocket maximum. The percentage that you end up paying is what's known as coinsurance. You may be subject to copayments depending on the types of services that you need. And a copayment is a flat dollar amount that you're going to pay each time you see that specialist. The final term I want you to be aware of is your out of pocket maximum. And this is the maximum amount that you are going to pay during your benefit period for your healthcare cost. This doesn't include your premiums that you pay every month, but it is the maximum amount that you would have to pay for your healthcare needs each year. Once you achieve your out of pocket maximum, your health insurance company will pay 100% of your medical costs for the remainder of that year. There are two types of plans that are most likely going to be available to you: a preferred provider organization, or a PPO, and a health maintenance organization, or an HMO. And depending on which type of plan you're in is going to determine how much you pay for certain services. With a PPO, you pay less when you use providers that are within that plan's network. You can use out of network providers, but it's going to cost you more. Because PPOs cover out of network services, you're most likely going to pay a higher premium for this benefit. With an HMO, you're limited to who you can see for the services that you need. You are limited to the doctors that are contracted with that HMO. Typically, HMOs don't cover out of network care unless it's an emergency situation. The limitations of the HMOs typically leads to the monthly premiums being cheaper than a plan under a PPO. With most healthcare plans, you're going to have plan categories. The lowest category is going to be the bronze, and this is typically going to have your lowest monthly premium, but it's also going to have your highest out of pocket maximum. Remember, those two things work in opposite directions. With a bronze level plan, you're also going to have the highest deductibles. You're going to pay much more out of pocket for your healthcare needs before your health insurance plan kicks in. In most cases, with a bronze level plan, you are going to pay about 40% of your medical costs, and your health insurance plan will pick up the other 60. The main goal of a bronze level plan is to protect you from a catastrophic event. If you're healthy and you don't have any health issues, then all you're protecting is from a freak emergency room visit. You're not worried about constant doctor visits and having to go see specialists all the time. You're generally a healthy individual that only wants to protect from something that is catastrophic. A silver level plan is the middle of the road when it comes to cost. Your monthly premium is going to be a little bit more than a bronze level plan. Your out of pocket maximum may be the same as the bronze level plan, but it also could be a little less. And your deductibles on a silver level plan are going to be less than that of the bronze plan. The silver level plan is a good fit for those who need some prescription drugs and maybe the occasional visit to a specialist, but overall they're in pretty good health. With a silver level plan, you're going to pay about 30% of your healthcare cost. And then your insurance company is going to step in for that other 70%. Gold and platinum level plans are going to cost you the most each month. They offer the lowest deductible and, in most cases, the lowest out of pocket maximum. If you need a lot of care or you require expensive prescription drugs, then this type of plan is probably going to be the best for you. Typically, someone on a gold plan can anticipate paying about 20% of their healthcare cost, with the insurance company picking up the other 80%. And then, if you are eligible for a platinum level plan, then you can anticipate paying about 10% of your cost, with the insurance company picking up the other 90%. So, which level is the right one for you? Well, there are a couple of factors that go into determining which level is the right one. First, and it's kind of the unknown, is your expectation of use. If you don't think that you're going to use the doctor much over the next year, then a bronze level plan may be the right one for you. But if you run into health issues and you have to visit the doctor more than maybe you have in the past, then a silver level plan might have been the best option. But you don't know what your usage is going to be until it actually happens. Next is the cost. The price of some of the plans could make them impractical for your budget. You need to determine if you can afford the deductibles that you might have to pay, if you can afford the coinsurance and the out of pocket maximums in the event that something catastrophic happens. When it comes to cost, I would never sacrifice your coverage to save money. Ensure that you have the right plan for you, just like all of the other insurances that we go over. It makes no sense to sacrifice coverage just to save a few bucks. Make sure that you have the coverage that you need. The third thing that you should consider is a health savings account. If you're a healthy individual and a bronze plan is the right one for you, then pick one that has a health savings account available to it. That health savings account is the triple tax-free savings account. You can put money in and save taxes now. The money can grow within the account tax-free, and then if you pull the money out for a qualified medical expense, then those withdrawals are also tax-free. One of the largest expenses in retirement is your health care. So having that tax-free source of money that you can pull from to pay for that care is always a good thing to have. There are a few ways that you can go about getting health insurance. For a lot of people, they're going to get their health insurance through their employer's group plan. The other option, if you can't get health insurance through your employer, is to go to the marketplace or healthcare.gov. Some may have to wait until open enrollment before they can get onto a marketplace plan, but if you experience a qualifying life event, then that opens up a special enrollment period for you. These events include things like losing coverage. So if you leave a job that offered you health insurance for another job that may not offer health insurance, this would count as a qualifying life event. If you have a change in the size of your household, if you get married or divorced or you have a child, then all of these things can open up that special enrollment period for you to get new coverage. Also, a change of residence. If you move across state lines, that move counts as a qualifying life event and will again open that special enrollment period for you. There are options for you to get health insurance. So if you find yourself in a position that you need health insurance and you don't have access to health insurance through your employer, the first place you're going to go is healthcare.gov. And this is the federal insurance marketplace. If you live in the state of Virginia like I do, Virginia has its own health insurance marketplace website. The address for that is marketplace.virginia.gov. When you get to the homepage, you're going to go to Get Covered. We're going to browse for health and dental plans, and then we're going to start giving the system some of our basic information. So the first thing they want to know is where you live, and they're going to determine the plans available to you based on your zip code. Next, we're going to start giving them information about our household or who's looking for this coverage. So first, we're going to go with my wife. I'm going to add my son, and then I'm also going to add myself. Even though I don't need health insurance coverage through the marketplace because I get it from Veterans Affairs, it's still important that my information is included. The reason this is if we are eligible for any premium tax credits, it's going to be based off our household size and the amount of money that we anticipate bringing in. So even though I'm not seeking coverage personally, I need to include myself. And then in this box, we're going to put in the amount of money we anticipate making over the next year. So we're going to put in $60,000. We're going to click See if you qualify. And it's going to tell us that we are eligible for an estimated tax credit of $427 per month. What this does is, of the plans that are available to us, the premium that the insurance company would charge is reduced by the amount of that tax credit. We're going to hit next. You can answer these questions if you would prefer. I personally am not for the purposes of the video, so we're going to skip this. And what you'll see is that there are 30 health plans that are available to us where we live. The cheapest of those health plans is the Centera health plan. The premium for this would be $50.48 per month to cover my wife and my child. You can see that there are copays for primary care visits and generic drugs. The deductible for this policy is $14,400. So for the first $14,400, you're going to pay the majority of your healthcare costs if it's not preventative. The total out-of-pocket for this policy is $18,900. For us personally, this isn't the plan that we chose. We decided to go with the Anthem plan with a $5,900 deductible, and it's also HSA eligible. So what this does is it allows us to save money tax-free, allows the money to grow tax-free, and then we can withdraw the money tax-free in the event we need to pay for qualified medical expenses. With this plan, our deductible is $11,800, and that's for the family. Our out-of-pocket maximum is $16,000, so both of those numbers are much lower than the $50 plan from Centera. Once we hit our deductible, we're on the hook for 35% of our medical costs up to that $16,000. This plan, based on our expectation of usage and the coverage that we actually need, is what fits our situation. We're relatively healthy people. We don't have to go to the doctor very often outside of preventative care. So when it comes to paying for health insurance, $80 a month gives us what we need. On the left-hand side of the page, you can sort all of the policies that are available to you by whatever criteria you want to see. If we were to take a silver level plan as opposed to the bronze level plan, the closest one would be the HealthKeepers Silver. With this plan, it costs $182 a month. There are co-pays as opposed to co-insurance, and the deductibles are slightly lower than what they are on our bronze plan. Paying the extra $110 a month didn't make any sense to me because we don't plan on using the doctor much more than for preventative care. Even though the maximum out-of-pocket and the deductibles are lower, it doesn't make any sense for us to pay the additional $110 a month when we don't anticipate using the doctor that much. In the end, if you make it to this point and you're not sure exactly where you need to go or what you should do next, you need to find someone that is licensed to sell health insurance. They can walk you through all of the policies that are available to you. They can get more in depth on what these policies cover and what they don't. And by doing this, you can ensure that you're getting the coverage that you need for yourself and your family.